talking about eliminating the use of SNAP benefits to purchase soft drinks.
We aim to realign the spending of the government's largest nutrition program, which has the potential to be the most important health and nutrition initiative in the United States, and to develop a framework that can be applied to all government spending. Under the Constitution, government spending is intended to promote the general welfare of the United States. We began with our own agency to realign and support our own mission by restricting agency funds and prohibiting zero nutritional items from being purchased. A program with the stated congressional intent of supplementing the nutritional needs of low-income residents should not include funding for items that have zero nutrition, displace nutritional foods, have been shown to be addictive, harm health, and have caused egregious health outcomes we don't have the resources to treat. Our focus is on oral health. Education can't compete with the aggressive advertising, marketing, and branding of big beverage, and the cultural acceptance of harmful behaviors such as sipping harmful beverages all day. Our National Guard co-sponsors the Mountain Dew NASCAR car, our children are marketed to directly, and our teenagers are inundated with messages that it's cool and will help their image.
As you may know, most dental disease is preventable today. There's a certain amount of personal responsibility involved, our habits, our diet, tobacco use, hygiene. This is a pervasive problem in our society, not just for low income. But what we're trying to do through education, prevention, and policy. All the treatment programs in the world will not fix some of the problems that are out there. So education, prevention, and policy. This needs to start, of course, with a pregnant mother. You may or may not know that a mother that's a pregnant mom is at high risk for preterm or low birth weight babies in delivery if their mouth is not healthy. And we also know that a child is not born with decay-causing bacteria. They usually acquire it from their primary caregiver, which is usually the mother. So the mother's health is even more important when we're looking at this issue. Advances in dentistry, have come a long way. We can fix most problems, but they're quite expensive. And our system has come, the long history of the soft drink industry, as a slide that you'll see again, the mother giving a child cola, that has been pervasive in our society.
$1.50 a meal, $4.50 a day. Think about that. Now think about any experiences you've had on the first of the month. What do you see in a lot of the grocery carts? Most of the messages coming from anti-hunger groups are relaying messages directly from sponsors they rely on to operate, food companies that direct lobbying efforts and involve all efforts that would impact their bottom lines. Feeding America received a $10 million commitment. The Food Research and Action Center Gala was sponsored by these companies, and the Congressional Hunger Center's annual ceremony was sponsored by Monsanto, PepsiCo, and the American Beverage Association, among others. It's the industry's messages being carried by these groups. A poll commissioned by the Harvard School of Public Health shows that 69% of people support these type of restrictions, and when only surveying SNAP beneficiaries, it drops to 54%, but shows the majority supportive.
Some of you may be familiar with this, but the main reason that tooth gets decayed is from acid, okay? We have bacteria in our mouths. That bacteria likes sugar like we do, and a byproduct is acid. In soft drinks, in colas, there's sugar plus phosphoric acid, which is the carbonation. And in lighter beverages like Mountain Dew, Sprite, they have citric acid along with the sugar. So someone who's in a habit of sipping all day, we're not even arguing about amounts here, we're talking about frequency. Sipping all day, bathing the mouth in acid, breaks down the tooth and causes decay. Okay? Our yes, sorry to have this picture during your lunch, but this is a part of my life every day, working with low-income adults. It's pervasive in our low-income society. 80% of tooth decay is in 20% of the population, and it's of those of low income. Our West Virginia, this is talking about our pH, the acidity. Water is 7, that's neutral. The pH where a tooth will decay is at 4, and most soft drinks are below 4. 2, 2.3, 3. The Mountain Dew, these types of lighter beverages with the citric acid are actually more harmful than the colas because of that citric acid. Now, in our state, especially for adult Medicaid, the only benefits are for tooth extractions, emergency care, and no mechanism for replacing teeth. So if someone does not have teeth, does not have all their teeth, it's a self-esteem issue, it's an employability issue, it's a nutrition issue. They can't eat all the foods they'd like to eat.
Policies save lives. No amount of education could have the same impact that policies do. We saw it with cigarettes, we saw it with seatbelts. Once upon a time, if you saw a child standing up in the backseat of a car today, you think child abuse. I want to see the day that when we see young mothers putting it in baby bottles and sippy cups, that it's looked at as the same type of child neglect. Low-income people are already stigmatized through appearance, self-esteem, bad teeth, and being on Medicaid. They're already forms of stigmatization. Rotted teeth contribute to employability, absenteeism, and when you consider that 51 million hours were missed by school children due to untreated dental decay. And a quote that was cited earlier that the highest prevalence for absenteeism for children was asthma. Actually, the prevalence is 5 times higher for dental decay. And finally, research is coming out linking consumption of these beverages to behavioral problems in schools, including aggression. Education can't compete with the aggressive advertising, marketing, and branding of big beverage, and the cultural acceptance of harmful behaviors such as sipping harmful beverages all day.
There are a lot of resources out there, and a book that was referenced, The Covered Smile, really hits home. West Virginia consistently ranks as #1 for oral health in the nation. We have most people that have lost some or all of their teeth, and which is called a dentulous, or have dentures. We have 2 paths we can take. One is of health, where we're trying to help all of the population, or
we're continuing to waste money on things that we paid for twice. First in the purchase and then in the treatment. Yeah.